A warm welcome to all our viewers to our series, Natural Medicine. Now, I'm lucky again today that my guest is Dr. Petra Wiechel of the Swiss Mountain Clinic. And I want to welcome her warmly. Welcome.
Thank you for having me.
I am honoured and happy to be able to talk to you because you exude such calm and empathy and such a holistic knowledge. I think every viewer at home can hear a pin drop when you talk.
Yes, thanks.
And I want to follow what you're telling us today. I'm also learning so much from talking to you. The subject today is autoimmune disorders, which have immensely increased. In our preliminary talk, you said how many autoimmune disorders are there already?
We know about 170 today. I studied in Berlin in the 80s, and they wanted to show us a patient with Hashimoto, the thyroid autoimmune disorder. They couldn't find one. Today, almost every third or fourth patient has a Hashimoto's thyroiditis.
Every third or fourth?
It increased quickly.
When I was a child, there was only one single person at school that was allergic to strawberries.
Yes.
Today, everyone has some allergies.
Allergies, yes, but autoimmune is still a bit worse.
It's horrible. It's being allergic to yourself.
Inflamed against yourself, yes. The body builds up an aggression against itself, which is also classified as such. And from that moment on, you don't have a chance to reduce this inflammation. And it's being treated anti-suppressively. They are working with anti-inflammatories. And in this way, it might be helping in that moment, but it is not solving the problem.
That's the academic medicine working with anti-inflammatories. Is that natural medicine or intravenous drips?
It's not about natural medicine or about the therapy, but you have to know that the development of an autoimmune disorder, that the immune system is working against the body, is based on a series of reasons. And we know with autoimmune disorders that, for example, every autoimmune disorder starts with non-intact bowel. There are no patients with tumours that have a healthy bowel. There are no patients with rheumatism that have a healthy bowel. It all starts there.
This is so nice and clear. It's like having a prescription from you now. That we have to look after this.
You have to look after this very well. The second thing is that autoimmune disorders need some kind of genetic disposition. With that I mean that we are all made differently and handle the same problems in different ways. And in the precious talks we have spoken many times about detoxification, for example, and the important function of the liver. And if the detoxification capacity is less, your body is not able to eliminate toxins, contamination out of your body in the same way if you are weak. That does not mean that I am not able to compensate a certain amount of heavy metals. My body is big, it can penetrate the tissue. It can also store. But if the toxicity is bigger than the opportunity to discharge the toxins, or if it's used to capacity, also the thyroid, for example, takes in toxins. This causes a second important column in the development of autoimmune disorders. And this genetic disposition and the toxic contamination that weakens the immune system, so my defence is also weakened. This contamination causes, in the thyroid, for example, with Hashimoto, reactivated Epstein-Barr viruses, which are lymphotropic and neurotropic viruses. Mononucleosis is an Epstein-Barr virus, so mononucleosis is also called mono. And these viruses cause chronic inflammatory processes that we know today. And this causes thyroid tissue to be destroyed. With an autoimmune disorder, you also measure the antibodies against the thyroid. And it's thought that this process has to be treated suppressively to weaken it, to regulate this inflammation. But this is not the solution of the problems if you don't understand which processes caused this previously. And the clinical approach for an autoimmune disorder for us is, of course, that A, the patient gets examined in time for an autoimmune disorder. That means I can already measure a multitude of beginning antibodies that act destructively in this direction, that direction, or the other direction, but not because they act knowingly destructive, but because the bowel used to be weakened in its immune response previously. And the big substance triggering inflammations in the bowel is, for example, the gluten or the glyphosate. If then the mucosa permeability is opened, so-called endotoxins, which are bacterial, viral, parasitic toxins, transfer skatole hydrogen sulfide into the organism. This causes so-called LPS, antibodies against those lipopolysaccharides, because the body has to deal with all these things. And our immune system works like an army. I have the artillery, the infantry, and if one can't deal with the load, I have to call the next one. I have to call the next. That means my body is already at work every day to reduce the load for us. But if nothing changes because of the penetrating situation of the bowel, the person continues eating gluten. Maybe they don't know yet. Maybe it's someone with a functioning digestion and they don't know that they have a so-called leaky gut syndrome. Then the immune defense is in a constant smouldering fire and is called and required, and eventually its last resort are antibodies. That is the immune system that we get and what is focused to be against something. So the thyroid is collateral damage, or maybe the internal walls of the veins or of the arteries, or psoriasis and so on. There are many autoimmune disorders that show our body, well, actually, this is desperation, and the body was left alone in the conflict with all these things, and also didn't have the chance to use its own force to solve it.
But if I listen to your story about the bowel, leaky gut, how it enters, it's so logical. So logically, this would mean for me, if I start to rehabilitate my bowel, close the leaky gut, then I would have the chance that the autoimmune disorder disappears.
Well, the question with the autoimmune disorders is, and I think we are required to recognise them beforehand, that we analyse the condition beforehand, and that the monitoring of the bowel barrier becomes our doctor's duty. Because we can see this condition in 3/4 of our patients. That means, if I notice early, start regulating early, and by that stop the process early, catch the inflammation in the thyroid early, that will destroy healthy thyroid tissue and will finally cause a thyroid hyperfunction, and by that push the immune capacity into a healthy balance and return its energy that is wasted senselessly every day. Then I have the chance to stop this autoimmune disorder.
Or don't get it at all.
Or don't get it at all, exactly.
But what you said now, does that mean our viewers at home should go to the doctor now and should ask for an examination of their bowel milieu? And what exactly should they ask the doctor?
Yes, it is very important to measure the so-called secretory IgA from a stool sample. That is one of the parameters that decide how the so-called secretory immune system of the bowel works. This value tells us 80% of our immunity, the secretory IgA. There is another interesting factor, which is calprotectin and the alpha antitrypsin. There are two parameters that show how far open this barrier is, how far along the leaky gut syndrome is. And if the diagnostics can go even further, what would also be nice is a so-called high-sensitive CRP. This is a silent inflammation parameter to see if the body is actually stuck in this smouldering fire and if the immune processes are working constantly to fight against all these things that have spread inside the body without the patient knowing about it.
This can all be seen in the stool?
Yes.
And can a doctor analyse it when receiving all the values? Do they understand it? Did you learn this?
We have not learned this at university, never learned this at university, and if a family doctor is doing stool examination, then this is usually limited to 3 stool samples, to blood in the stool, or maybe to pathogens in the stool for the diagnostics of diarrhoea. It would have to be someone with a deeper knowledge, who also knows where to send the stool to, and mainly, I think, this is the domain of a complementary health practitioner. Going back to what you said before, that everything is biological. Yes, it is biological medicine. And for this, it is logical that the processes that our body is doing, that are all extremely meaningful, can only be regulated like this. And the nice thing is, the body is doing it. It is doing it, if we help it before, if we only face it with an anti-substance, but leave it alone with the rest, then we can't expect the thyroid hyperfunction to be responded to with a hormone. But I always have to question a thyroid hypofunction. Why did the thyroid get into that situation? This doesn't have to be because of an inflammation through an autoimmune disorder. This can also be due to a lack of selenium. Because without selenium, the thyroid can't change the thyroid hormone from T4 to T3. Without iodine, I can't produce enough thyroid hormones. I am shocked at how few people have enough iodine. And I think these are the things that, if we understand how they develop, then we also understand where we can start from. And our body is so thankful because it's returning to its old pattern. It is trying 24/7 to go back to this. And I think we should never question this. And we should never doubt this. It is like a child. When a child grows up, it grows up in this basic sense of trust. Whatever happens, the parents are there. And I, as a doctor, have never lost this.
So someone suffering from sicknesses has the chance to recover if they find a specialist like you, who's trying to find the cause of it. And for the prevention, we, as consuming people, are responsible to tell our doctor that we want to have this stool analysis if we want our bowel to be healthy. And these values that you said...
And of course, also having to look into it, it is actually a bit presumptuous. If you think you're taking a look and then say, it's all good. It is not possible for the human eye to see a latently slight inflamed situation through an endoscope. I can just look and maybe not find an adenocarcinoma. That is very well, thanks. But if I find it, I'm already quite late. And if I find nothing, It doesn't mean that my mucosa is in such a severe situation that it's already developing in depth and I can only see it next year. That's why I think that we have to do a stool examination for all our patients every year, so that they are taking the responsibility through their diet, or also with all those probiotics. These are all things that I can bring back to balance with a healthy diet. I don't even have to think about adding dietary supplements. We are living in a time in which we don't eat fermented food anymore.
Gone.
And especially the right-spinning lactic acid, which is so important to buffer the blood, to ensure its ability to regulate and flow. It is produced by lactobacilli, which make up 80% of the flora. And just adding these lactobacilli through sauerkraut juice or through organic apple cider, well, this is so precious, but we're not doing it. And if we do the stool examination, I see in 80% of the cases that this bacterial flora is not sufficient. And from this, what can happen is that the pH value of the stool, which is normally 5.5 to 6.5, goes up to 7, 7.5, 8. But if it's raising to something alkaline, then the body can't discharge any ammonia anymore. But ammonia originates in the processing of proteins. Now I have a leaky gut. The ammonia is moved, but where does it go?
It turns to ammonium, which then goes to the blood and the brain.
Exactly. First, it is our mother's liver's turn to say, the party is over. This is not my duty anymore with so much urea and uric acid, and then you'll have gout or something. What I want to say is what has an elementary meaning is what we call the microbiome, and everything else is dependent on this, and you don't treat a sickness up here. You learn to understand it. That actually is the
base.
Yes. You also can't build your house on a small base.
No, you can't.
And these have to be patient processes. People who say, go, 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 how much longer, doctor?
But instead of doing a colonoscopy each year from the age of 50, or a mammography every few years, it would be a healthy preventative measure to get a professional stool analysis once a year.
For example.
It doesn't cost much, does it?
It does. It costs about 200 to 300 francs. But what is this compared to a wellness weekend or whatever?
Let me guess, the insurance is not paying the stool analysis, is it?
No, it's not that. It's not. But I honestly have to say the clients that we take care of are interested in the content. I don't have to talk about it much. They know that the health insurance is not covering it. But they relieve me and say, maybe I can't afford to do this or that this year, but this is so much more important to me. I have to change direction. I ended up in a dead end and thought I can't move on. And these are only small steps, but very precious ones. And this is how positive processes develop.
But these patients only think like that because the horse has bolted. And to lock the stable before it was a nice way for you to say preventative measure. Once a year, a stool analysis. But I also realise when I talk to other experts that many can't read this stool analysis. Is it so complicated?
Yes, it is also important that they know about these parameters. Of course, but so much can be taken from it. Also, such neurodegenerative disorders like Parkinson's and MS, they all start there. They have their cause there.
Unbelievable.
So it also can't just be a neurological problem. The neurological problem can't be solved if all the other things that belong to its development are not considered.
I'm so proud when a doctor's sitting here and is sharing a holistic knowledge from academic medicine and complementary medicine. Two sciences brought together as a whole, and is looking at the human being as a whole, and not just the autoimmune disorder, but the cause. That fills me with so much happiness. And I'm sure you too, dear viewers. That is the art of medicine, I would say. It also used to be like that in the East, in the Asian medicine, wasn't it? That they looked after the milieu much, much more.
Well, we didn't do it in the East. We were just...
I don't mean the German Democratic Republic, no, I mean Asian medicine.
Of course, yes, of course. Of course, what we used to have to do is to work out of nothing. There was not much substance. And we also grew up with many household remedies. And I always try to reach a lot with very little. And just to explain to people what they can do and what will happen if they don't do those things. Because there is a very simple example. You have to take care about your cell if it is supplied well. And if the cell is supplied well, that means your microcirculation, the smallest capillaries of the big circulation, take oxygen to the cell. If the cell of your heart, your liver, your brain is supplied well, comes all down to the capillary transports the oxygen. But what we can see in the dark field is that the red blood cells are often blocked through overacidity, through lack of lactic acid, through cellular network and so on. That means it already stops before this capillary net, which supplies the heart cells and the liver cells. So the cells will come into a hypoxia. They are lacking oxygen. If the millbar pressure of oxygen drops by 100 in the cell, it causes a viral reactivation. It suddenly causes viral processes. The virus is intracellular. The cell can and has to fight for survival and produces left-spinning lactic acid, so a biological doctor verifies that the microcirculation is activated. There is no sense to want something if the supply on the cellular level is not guaranteed, and just the microcirculation of the capillaries is 77%. So a common internist will take a pen, it's an ultrasound, a Doppler, checks the big carotid and says, great, nice circulation, but the carotid is the highway. Everything passes there.
It has to.
The life, if you will have a stroke or a heart attack, it has nothing to do with how big the vessels are, supplied with blood, but it's happening on the microcellular level. And I dare to claim that surely the sully of the big coronary arteries has to be fine, and that there will also be blockages there that will accelerate an acute event. But from my experience, it's an artery that has been blocked for a while. The body can compensate all that through the microcapillaries, but as part of a disturbance in the microcirculation. The conflict is happening, stress is happening. We have the loss of love, and the capillaries close. And the infarct is there. These are the things that I have experienced. If I may tell this story, I have a father who 4 weeks ago at 89 closed his eyes with me. And I've never seen him sad, never seen him unhappy. Never. He was always like sunshine. But my father had a dog, and he was in his early 70s, and my father has never lived in a healthy way. He loved eating unhealthily, and he loved to have a drink now and then. And me being his daughter, I watched him, but he was always in good health. The compensation was there because he had this contentment. And then he wasn't able to put his dog to sleep. It took him 6 weeks. And in these 6 weeks, I could watch how he became very sad. And I was afraid that he couldn't force this process any further, otherwise something would happen on this level. And it took him 6 weeks. The dog was put to sleep on Wednesday, and the next morning at 4 a.m. he had a heart attack. I just want to say, this is how it happens. One of the ways of compensating is falling apart. If a person is also in an emotional conflict, and these are the things we have to understand. And then we can make so much out of that.
It just happened.
Yes, but he was 89.
Then it is allowed to happen, but still my condolences.
That's very kind, but for me, really it was a present that he was able to just fall asleep and didn't have to...
Suffer much, yeah.
Not at all. Who is able to just fall asleep when they're old, right?
Yeah, that is a present.
A huge present, I think. Thanks.
Dear Petra, thank you so much. I'm sure my wife will agree with me that we know where we will plan our next holiday. It's so good to know we can get through a thorough medical check and we know where we are at. And we'll also learn a lot.
Exactly.
So that we can be responsible to know what is good for me and what not.
Exactly.
Even if I have so much to learn and I like to do it. Thank you for sharing your wisdom with us.
Thank you too.
You're welcome. To you, dear viewers, thank you for watching. You heard that nothing is impossible if you're going back to the base and are starting to act and repair there. If we activate processes, so much good can happen. And I wish that you and to all of us, thank you for watching and see you next time.